Alright, so today we're going to be talking about my top exercises for lower back pain. I want to go through, create this video for our viewers and some of our patients that kind of gives you guys a chance to do stretches, exercises at home in between office treatments that are recommended for lower back pain. So we have our patient here today. First, we're going to clear out her lumbo-pelvic spine before we start the stretches and exercises. So let's take a look. Can you lay face down here on the table here, please, Victoria? So we're going to start with a quick leg check to see which direction the sacroiliac joints have moved. Scoot down just a little towards me. Alright, so we've got a short leg on the right. So we're going to start with the right sacroiliac joint. Can you lay here on your side, please? Face me. I'm going to bring this top leg up. Good. We'll come in just a little bit. Scoot over just a little bit towards me, Victoria. Good. Top leg up. Very good. And let's see the other side, please. And top leg's going to come up. Okay. Scoot over just a little towards me. And the shoulders back. Great. And let's see, will I face up again? Now we're going to clear out the lower thoracic spine right above the lower back. We're going to cross both arms here. Good. All right, we just finished the patient's adjustments. Now we're going to start with the lower back exercises. All right, so one of my favorite exercises for lower back pain is the Superman. And the reason why it's such a great exercise and used so often in chiropractic and physical therapy is you're able to get such a broad range of the muscles in your lower back, mid back, upper back, and your lumbo-pelvic spine as well. So let's go through right now, demonstrate the exercise, and I'm going to kind of go through some of the muscles that are worked and why it's such a great exercise. So we're going to start with the patient here. We're going to go on your hands and knees here on the table. Now, for the optimal position for this exercise, we went the hands shoulder width apart. That's perfect there. Knees shoulder width apart. Straight line with the back. So this is good here. And you want the head neutral too. Imagine we have a broomstick going up the spine in a straight line. We may want to dip the shoulders down just a little by bringing the hands apart just a little bit too. Okay, this is perfect. Now we're going to raise the left arm, thumb pointed to the ceiling, and as that left arm goes up, the opposite leg straightens and extends. As you can see, we're getting the mid-back, the muscles in the mid-back, we're getting the lower back muscles, the gluteal muscles, and the lumbar paraspinal muscles. Then we'll come back down. Another important thing we want to focus on in this exercise, keeping the core activated. So we're going to bring the belly button in towards the spine, squeeze from the sides. Good, core is nice and tight. And then we activate the right arm out. Good. Opposite leg, great form. We hold for a couple seconds, then down to neutral. Then we alternate again. Left arm, right leg. Hold for a second. Back down to neutral. Same thing, right arm, left leg. Good. Perfect form. She's working all of her big muscles in her back, the small stabilizer muscles, the hip extensors. You're able to get a broad range, some of the posterior deltoid muscles around the shoulders. It's an excellent exercise for lower back pain. And what you can do also in your rest, have you ever done the cat crawl where you tuck your belly in and kind of arch your back up. There's a good stretch. Yeah, breathe in, lean down. As you take a little rest, you can really stretch out your lower back muscles in between as you get a little bit tired too. So a major component of lower back pain and working on your lower back pain is strengthening your core. And I love this exercise because it's such a great core strengthener to kind of work and focus on the small little core stabilizers, your oblique muscles, your abdominal muscles, your transverse abdominal muscles. So let's go into the exercise right now. We're going to start with having the patient bring their legs up. And keep in mind, we never want to go below a certain level with the feet. As we start to get down here, it starts to really pull on the lumbar spine and the muscles in the lower back. And if you have an underlying back condition, you can re-injure your back. Or if you don't have a severe underlying condition, you can make that worse. So you want to be almost 90 degrees with the toes and the feet. So from this position, we want to kind of bring the feet out. Imagine we have a basketball or a volleyball right in between the toes, and we're going to, from this position, come up in a small crunch, look up, keep the head neutral, support your neck with your hands, and imagine that there is a basketball, volleyball in between the toes. We're going to go around the imaginary ball with the toes. While we're doing this, we want to keep the core activated, keeping the belly button tucked in towards the spine. This is going to work your core muscles, which is a major component if you have a weak core to experiencing episodes of lower back pain. We're going to squeeze from the sides, and we're going to keep going until we start to feel the abdominal muscles start to fatigue a little bit. Just going around, imagine the ball around the toes, around the toes. You're also going to work some of your hip muscles in this exercise. It's a great exercise for lower back pain. All right, another great exercise for lower back pain is pelvic bridges. So how we're going to start is the patient will lay on their back, face up. Knees are going to be shoulder, feet are going to be shoulder width apart. And we're going to, from this position, push the pelvis and back up towards the ceiling. Hold for a second, and then down. And as we push, we're going to push through the heels of our feet, keeping the stomach tight, belly button tucked in towards the spine, push up through the glutes, hold at the top for a second, and then down. Pushing up through the heels towards the ceiling, squeezing at the top, belly button tucked in, squeezing from the sides, and then back down. Same thing, up through the heels, good. Belly button in tight, everything squeezed from the sides, activate the core, and then back down. This is not only a great exercise for acute low back pain, but on people that are over 60 years old, that some of the exercises are just a little too complicated. This is a very good exercise for older patients. It keeps it simple, and you're able to work a lot of the muscles in the pelvic spine and the lower back, and the core as well. Another great exercise for lower back pain is a simple twist and stretch of the lumbar spine. We have a small stabilizer muscle that runs up through the spine called the multifidus muscle. And what happens is we sit at the desk all day, we sit at the office chair, this tiny stabilizer muscle stiffens, tightens like a tight rope that isn't being used, or a rubber band that dries out, and it starts to develop this pain mechanism in the lumbar spine. So we want to make sure we keep this small stabilizer muscle, the multifidus, nice and flexible and loose. And a good way to do that is it's the muscle that stretches and keeps your spine in place when you twist. Just by simply twisting the back a little bit, we can keep this muscle flexible and activated. So we're going to have the patient cross their arms, lean forward just at a small angle, and right there we're just going to twist to the right. Good. Hold for a second. Twist to the left. Hold for a second. Good. Twist to the right. Good. Hold for a second. Good. Twist to the left. Good. Back to the right. Very simple exercise. You can do it in 5 minutes, 10 minutes a day, a couple times. You start to feel a little stiff at the office chair throughout the day. You can take 5 or 10 minutes, stretch your back out. Once again, it's the multifidus muscle. It's an excellent exercise for lower back pain.